Hello guys, today we are going to talk about rabies. Rabies is very rare disease in developed countries, however it is very common in developing countries. It is the reason of about 59,000 people's death every year. As you know, the virus is found in the central nervous system of the infected animal. Only in the final phase of the disease, the virus enters into the mucosal membranes and is found in the saliva. When the animal is in the final phase of the disease, maximum amount of days that he can live is about 10 days. During this final phase of the disease, if the animal bites human, then the human gets infected as well. Or if the human skin is injured and the infected animal licks the injured area of the skin, then the human gets infected as well. Apart from this, if the infected animal licks the mucosal membrane of human, like nostril or mouth or eyes, then the human gets infected as well. It is much more likely to find the virus in wild animals like wolf, bear, or fox, comparing to domestic animals like dog, cat, horse, or donkey. However, most humans get infected with rabies by domestic animals. It is believed that wild animals infect domestic animals and then domestic animals infect humans. In some cases, the virus can be transmitted by a bat. So if a human enters into the cave which is full of bats, then he may inhale the virus and gets infected in this way. Rabies is not transmitted by animals like mouse, squirrel, duck, or reptiles like snake or lizard. However, if a human gets bitten by any of these animals, it is essential that he goes to the medical units because apart from rabies, some other microorganisms can be transmitted, like tetanus. Tetanus is the bacteria which is found in the soil, and if the animal like mouse bites to human, that bacteria like tetanus can be transmitted. So, going to the medical unit after a human gets bitten by animal is essential. Apart from tetanus, some other microorganisms can be transmitted as well. In this table, I have summarized everything you need to know about the type of contact and recommendations that you should do after the contact with the animal. So if human touches the animal or the animal licks the intact human skin, then there is no risk of rabies transmission and there is no need of doing anything. If the animal bites human skin in such a manner that there is no bleeding, so if there is superficial biting or superficial skin injury, then if the animal is domestic and she was vaccinated in the past 1 year, then you should clean a wound, do tetanus prophylaxis, and monitor the animal for 10 days. When I say clean a wound, I mean that you should wash the wound, the area where the biting occurred with the soap, and also disinfect with at least 70 degrees alcohol. If it is possible, it is never advisable to apply the stitches because it may it may increase the viral replication. Uh, as for tetanus prophylaxis, the chance of getting tetanus is much higher if the wound is deeper than 1 centimeters. If it is less than 1 centimeters, then there is still chance of getting tetanus, but it is much less. Monitoring the animal for 10 days is essential because if the animal is still alive after 10 days, then the chance of getting rabies is about zero. If the animal is domestic but was not vaccinated in the past 1 year and the animal looks healthy and can be monitored for 10 days, then applying the same procedure is enough. If it is impossible to monitor the animal, then apart from these procedures, doing the entire course of vaccination is recommended. In this case, applying giving immunoglobulin is not needed. Vaccination of rabies consists of 5 doses. First dose is given after the same day when the biting occurs. The second dose given after 3 days, third dose after 7 days, fourth dose after 14 days, and fifth dose after 28 days. If the animal bites human and there is bleeding, or the animal's saliva makes contact with the previously injured skin or human mucosal membrane, and the domestic animal was vaccinated in the past 1 year, then the same procedure as I have already described should be performed. If the domestic animal was not vaccinated in the past 1 year, and the animal looks healthy and can be monitored for 10 days, then apart from the previously described procedure, the first 3 doses of vaccine should be given, and also immunoglobulins should be given. The first 3 doses of vaccines, because these doses are given in the first 10 days after the biting occurs, and after 10 days, if the animal is still alive, then there is no need of giving fourth or fifth doses of vaccine. If the giving of immunoglobulin is effective only in the first 7 days after biting occurs, and immunoglobulin is given around the wound when the biting occurred. It is impossible to If it is impossible to monitor the animal, doing the entire course of vaccination plus immunoglobulin therapy is required. If the contact occurred with the wild animal, then doing the entire course of vaccination plus immunoglobulin is recommended. As you know, there is no specific treatment for rabies. The only treatment is vaccination. However, if vaccination occurs late, then the person unfortunately dies. The proton period of rabies is about 1 to 3 months. It is really less than a week, so vaccinating in time is essential. When the first symptoms appears, then the treatment is already too late, and the symptoms start to appear as soon as the virus enters into the central nervous system, and this may include headache, nausea, and vomiting, itching, and numbness of the affected area. After that, acute neurological phase starts, and it consists of hydrophobia. Hydrophobia means fear of water. However, there is no connection with water. The When a patient tries to swallow, his throat muscles and his diaphragmatic muscles contract, so it is impossible for him to swallow. And when he is given water, and when he tries to swallow the water, then the symptoms appear. So thus the name comes hydrophobia. Hydrophobia occurs when someone else blows air to the face of the patient, and the same symptoms appear like in hydrophobia, like contraction of throat muscles and contraction of abdominal muscles. Hypersalivation is the accumulation of saliva in the mouth. Normally a person makes saliva every minute, but he then swallows the saliva. But because the patient with rabies cannot swallow the saliva accumulates in his mouth. During the acute neurological phase, the patients are hyperactive and have epileptic seizures. Acute neurological phase lasts about 1 week and ends up in death. As I have already told you, unfortunately, that there is no specific treatment for the rabies, and as soon as the first symptoms appear, the patient dies. Diagnosis of rabies generally is done clinically. If the patient develops the symptoms and if there is history of animal biting, then most commonly he has rabies. Of course, the microscopic examination of cerebrospinal fluid, blood, and hair can also be done. If the animal is already dead, then finding Negri bodies in the brain biopsy is the gold standard. So that was for today. I hope you liked the video, and see you next time.